and welcome to this evening's webinar regarding the importance and value of vaccination against COVID-19. I'm David Hahn, MCNY's Associate Dean for Academic Affairs, and it's my pleasure to welcome you to this evening's webinar. To begin, I'd like to thank the college's president, Joanne Pissarro, and the staff and administration at Weill Cornell Medicine and New York-Presbyterian Lower Manhattan Hospital for sponsoring this evening's webinar. I'd like to acknowledge the participation of Dr. Renuka Gupta, our guest speaker, Professor Dominick Boyce, our moderator, Vice President for Academic Affairs, Humphrey Crookendale, Ms. Chuman Lai, the Manager of Community Affairs at New York-Presbyterian, and Tina Giorgio, MCNY's Director of Communications and Alumni Affairs. Ms. Giorgio will be managing the chat for this evening's webinar. And at this point, it is my pleasure to formally introduce the college's Vice President for Academic Affairs, Humphrey Crookendale, to offer some words of welcome.
Thank you so much, David. Good evening to all. On behalf of Dr. Joanne Pissarro, President of Metropolitan College of New York, the faculty and the staff, I want to bring a very hearty, warm welcome and greeting to all of our friends and our colleagues at Weill Cornell. We are so pleased to have all of you with us. As I said to Dr. Gupta and to Lai, as we were preparing to begin our seminar, it is so fundamentally important that we try to clear up so much misinformation and disinformation that is rampant in many of the communities that represent students at Metropolitan College of New York. And so we thank you for taking time out of your busy schedules to make this presentation on a critically important subject matter. Thank you, thank you, thank you. It is my understanding that Dr. Matthew Fink, who is the chair of neurology at Weill Cornell, is joining us tonight, and we want to especially recognize you and thank you for taking time out of your busy schedules to join with us. It would be negligence on my part if I didn't recognize Dr. Greta Strong, who is a friend and a faculty member here at Metropolitan College of New York, for being instrumental in bringing Weill Cornell and Metropolitan College together. So a big shout out to Greta. Thank you so much. I am going to stop there because I get excited once I start to talk, and that might take up the bulk of this webinar. I know what is interested in what I have to say. There's far more important subject matter information tonight. Again, thank you, Weill Cornell, for agreeing to share with us tonight. We look forward to a very informative conversation. Welcome to Metropolitan College of New York.
And Vice President Crookendale, would you on the college's behalf introduce Professor Boyce?
It would be my honor. So it is also my honor and my pleasure to introduce Professor Dominick Boyce, who is an adjunct professor at Metropolitan College of New York. Dominick works full-time for the city of New York, Harlem Hospital. He has in the past been a moderator for seminars such as this, for webinars such as this. He has conducted himself and acquitted himself ably, and we are proud whenever we see him in this role, because it makes us here at Metropolitan College proud to know that one of ours was one of the very first to be vaccinated. I believe his two children were two of the very first He said, I'm going to lead by example. And so we are also proud to have Professor Dominick Boyce, who will be our moderator for this evening's event. Thank you again.
Thank you very much, Vice President Crocodile. Professor Boyce.
Good evening to all assembled. I thank you for having me, to the leadership of the college, President Pissarro, Vice President Crookendale, Associate Dean David Hahn. I thank you. Once again, I'm Professor Dominick Boyce. I'm also, I played many roles in the city of New York. During the initial surge of COVID, I was part of the Health and Hospital Incident Command Center for COVID. I'm also the health chair for the Mid-Manhattan branch of NAACP, as well as on the State Health Committee, who's been working in partnership with the New York City Department of Health to provide vaccine equity throughout the communities of New York City. Again, I thank our wonderful partners here tonight, Weill, Cornell, and New York-Presbyterian for being a part of this webinar. This is the third webinar in our series that's been sponsored in partnership with other community partners. So I want to thank Metropolitan College of New York once again for taking the lead in addressing this vital information session, not just for our community, which is valued and there's still uncertainty, but also the wider New York City community. So our purpose is many-fold tonight. One, the first and most foremost one is to share accurate information on the COVID vaccine and the pandemic that we are facing right now. The second is to help build vaccine confidence. That's very important as we move throughout New York City and we're entering our third wave of COVID. That's very important. Just a quick, numbers just to put things in perspective. To date, New York City has lost over 53,000 people to deaths due to COVID COVID outbreak. And that's a significant number. And that's still the leader in the United States. And so again, overall, we've had over 2 million cases of COVID here in New York State. But recently we're doing really well, but we've seen a spike of 39% since last week in the cases here in New York City and New York State. So that's significant. We're now at a positivity rate of 4% in New York. Most recently, we were as low as 0.03. And so again, things are moving in the wrong direction. So it's important for us to continue to raise awareness about the Delta variant, which is the overwhelming variant that we're seeing, not just here in New York City, but also throughout the country, but also about the benefits of vaccination. And so today I'm honored to be a part of this webinar and to give the introduction for Dr. Renuka Gupta, at Weill Cornell Medical Center. Again, Dr. Gupta is the Associate Professor of Medicine at Weill Cornell. She's also the Chief of Medicine at New York-Presbyterian, Lower Manhattan. She comes with us with many years of experience, both academic and clinical. And one of the good things about Dr. Gupta is that she, volunteered to be here with us tonight, and I thank you for that. But also too, she has a lot of experience working with targeted populations such as these that we see in the COVID pandemic. Most of the patients that we see at not just the city hospital, but all hospitals, they come in through the ED, but they end up on a medical service where she's a chief of medicine. So she knows firsthand, how the pandemic has affected those within New York City as well as throughout the country. So I'm honored to, introduce her and be part of this webinar. And at this particular time, I'm gonna turn it over to Dr. Gupta. Welcome.
Thank you. Thank you so much. Thanks, Professor Boyce, for the lovely introduction. I really want to thank the leadership at Metropolitan College for giving us the opportunity to help educate our learners so we together can grow as a strong community. And I am very honored to be part of the speaker panel, trying to do my best to help educate and come to a common ground so we can work together as a united front. So thank you for the introduction, and it's a pleasure and an honor.
You are welcome. And at this particular time, we're going to see a presentation from Dr. Gupta.
So, good evening, everyone. I am going to talk briefly about COVID-19 vaccine overview and share with you the information that I have. So our discussion roadmap for today's talk will be: what is COVID-19? Why do we need to get vaccinated? How do these vaccines work? And how do I know the vaccines will protect me and are safe? Tell me different types of vaccines. And how come these vaccines became available so quickly while ensuring the safety? What are the side effects, the allergic reactions? What about pregnancy and breastfeeding? And the vaccine confidence that starts with you. The importance of information, communication, and transparency. Next slide. Let's start with the first and the foremost. What is COVID-19? So SARS-CoV-2 is the name of the virus, and COVID-19 is the name of the illness that it causes. Now, the modes of transmission is droplet. When we cough and sneeze, we can spread these droplets of saliva and mucus, and these are more than 5 microns. Or airborne, tiny particles, previous one, Chuman. Tiny particles possibly produced by talking are suspended in the air for longer and they travel further. These are less than 5 microns. Next one. Why should I get vaccinated? I'm just trying to get the chat out. Okay. Why should I get vaccinated? COVID-19 can have serious, life-threatening complications, and there is no way of knowing how COVID-19 will affect you. COVID-19 illness can present with any of these symptoms: congestion, runny nose, stomach upsets, diarrhea, fever, chills, cough, muscle aches, body aches, fatigue, shortness of breath, headache, loss of taste or smell, sore throat. Currently, over 2.3 million have been hospitalized with COVID-19 in the United States, and it has resulted in over 612,000 deaths nationwide. All COVID-19 vaccines currently available in the United States have been shown to be highly effective in preventing COVID-19. COVID-19 can have longer duration of symptoms or complications, which we are still learning about, affecting different organs of our body, affecting our heart, causing damage to the heart, causing enlargement of our heart and heart failure, worsening kidney function, causing blood clots, neurology, our brain, it can cause a brain fog, cause weakness, paralysis, paresthesias or tingling sensations, or respiratory symptoms such as difficulty breathing, and permanent long-term damage like fibrosis or lung scarring, all these complications of intubations. Reinfection can occur, and there are several case reports in the United States and other countries, some with worse symptoms and others with less. Why should I get vaccinated? Well, we need to get vaccinated not only to protect us, but our family and our community. So the vaccines are 95% effective at stopping COVID-19 disease for people with symptoms. More work is underway to learn more about how it works on people without symptoms. But our best evidence is that getting vaccinated can help protect people around you, particularly people who are at increased risk for severe illness from COVID-19. Stopping a pandemic requires using all the tools we have available. As experts learn more about COVID-19 vaccination, this may help reduce the spread of disease in the communities. The CDC continues to update the recommendations to protect the communities using the latest science. Next one, Truman. Let's talk about some history here to end a pandemic. 20th century, right? We had all these diseases, smallpox, diphtheria, measles, mumps, pertussis, polio, and look at the annual morbidity rate we have, all the way from 29,000 to 162,000 to 200,000. And what happened in 2019? Look at the cases reported. We dropped down by far, and the percentage decrease in the high 90s. Why? How did this happen? Well, there were vaccinations, right? Coronavirus currently in the United States, more than 35.2 million cases and more than 612,000 deaths nationwide. Next one. How do I know that vaccines work and are safe? Each vaccine has been tested in tens of thousands of people. 165 million people are fully vaccinated with COVID-19 vaccine in the United States. And vaccines are held to the same safety standards and testing phases as all vaccines. Next. All the vaccines are very safe and effective at preventing COVID-19. The current vaccines are 80 to 95% effective at preventing severe disease. No significant safety concerns, but mild side effects, which we will talk about. And vaccines cannot give someone COVID-19. Next one. How do vaccines work? A vaccine works by showing your immune system what a piece of coronavirus looks like. It's like essentially a mugshot of the coronavirus. So what happens if the real coronavirus tries to enter your body, it will be recognized and be attacked by the immune cells and the antibodies. Next one. How do they work? So let's talk about our messenger RNA. Messenger RNA vaccines, they create an instruction manual on how to make the spike protein on the SARS-CoV-2. And what happens? Our cells in our body make copies of that protein, and that eventually teaches our immune system to make antibodies and immune cells against that particular virus. Next one. And examples of mRNA vaccines we know today are Moderna and Pfizer. What about the DNA vaccines? How do they work? These vaccines use the DNA to tell our cells how to make copies of the spike protein found on the SARS-CoV-2. Instead of being packaged in a fat, the DNA is inside another virus called adenovirus. And adenovirus normally causes common cold, but it has been inactivated, so it does not cause the cold, but delivers the information about SARS-CoV-2. This helps it get the attention of the immune system. Next one. And the examples of the messenger, the DNA vaccine is Johnson & Johnson and AstraZeneca. Now, talking about these two vaccines, which is very commonly used in the United States, Pfizer and Moderna. 2 doses of Pfizer, 21 days apart, approved now for 12 and above. 36,621 people were tested, and it provides 95% protection against COVID-19 infection and symptoms. What about Moderna? Again, 2 doses, 28 days apart, approved for 18 and above. 30,000 people tested, 94.5% protection against COVID-19 infection with symptoms. The viral vector vaccine Johnson & Johnson, 1 dose, single dose vaccine. 2 doses are under study. It's used for 18 and above. 44,325 people were tested, provides 72% protection against moderate to severe COVID-19 disease in US, 66% in Latin America, 57% in South Africa because of different strains with some resistance, and 85% protection against severe disease. Let's talk about some vaccine data. US population is around 328 million. Pfizer, previous one, Truman. Pfizer, we have 194 million people vaccinated with Pfizer and 139 with Moderna. With Johnson & Johnson, 13 million. Next one. How was the vaccine created so quickly? A question that is very commonly asked. Clinical trials were overlapped. Manufacturing began while the clinical trials were still underway. And FDA and CDCs are prioritizing the review and authorization of COVID-19 vaccine. There are thousands of diverse people who volunteered for these trials. Pretty much the trials and the manufacturing was done in parallel. And that's why we got them done so quickly. Next one. Now, monitoring the safety after the vaccine is approved is also very important and crucial. There is a strong post-approval monitoring system through the 4 CDC systems, including the Vaccine Adverse Event Reporting System, which is VARIS, and the vSafe app. Safety data across all of the systems are analyzed and reported each week. Next one. How about the new strain? Let me just talk to you a bit about the strain, a mutant, what are all these terminologies? When the coronavirus makes copies of itself, it sometimes makes copying errors. And these copying errors are called mutations. That's number one. Now, sometimes these mutations change the way the virus behaves, like how easy it is to spread to other people and how much it can avoid an immune response from your body trying to fight it off. It's like a family tree. When a group of viruses share a set of mutations that change the way they behave, that is called a strain. So if epidemic continues, viruses spread, they mutate, and they form new strains. Vaccination is our best tool to stop the mutation and the new strains. They will help protect us against new strains, but may not be as effective. But vaccines are still highly recommended. We know these strains that we were seeing from the UK, the B17, the B135, and the Brazil. Next one. Now, the talk of the town is about the Delta variant, the most common strain. This was originally discovered in India last December and has now become the most dominant and the most worrisome strain of the coronavirus circulating globally. The most transmissible variant yet is Delta is roughly twice as contagious as the original COVID strain and as much as 60% more contagious than the Alpha variant, which itself causes numerous waves of pandemic around the world. As of the end of July, the Delta has been detected in nearly every country in the world and has fueled rapid outbreaks in places where vaccination rates are low. Delta has also quickly become the dominant strain in the United States. However, vaccines are still proving to be effective against the Delta variant. Next one. Let me share with you some facts. At least 125,000 fully vaccinated Americans have tested positive for COVID. 1,400 of those have died. Breakthrough cases, represent less than 0.08% of the 165 million plus people who have been vaccinated since January, or about 1 in every 1,300. Not only that, I do want to share this data with you. There have been 540 COVID-related deaths of children under the age of 17 in the United States since last year. Transmission of COVID remains possible even from fully vaccinated individuals, as in Massachusetts. Sharing a little bit about New York-Presbyterian, which has 10 campuses in New York. At the peak of COVID last year, we had 2,500 COVID patients all across. And today, our numbers are 125 patients in all our 10 NYP campuses. I'm just sharing with you our original peak and our current state with the Delta variant. Okay, we'll talk about it. I also want to share some common questions that I get asked on a regular basis, and I thought I'll just share it and then we can take more questions. The first foremost is, I have already been infected with COVID-19 and I have COVID-19 antibodies. Should I still get the vaccine? The answer is yes, yes, yes. Because some people have become reinfected and the vaccines might provide better protection. If I get vaccinated, do I still need to wear a mask and practice social distancing? Again, the answer is yes. Because at this time, we do not know if the vaccine prevents all infections. And it is possible that you could still spread it to others. How long will the protection last? We do not know it yet, but studies are ongoing to answer these questions. Still a few questions. What about allergic reactions? Everyone who gets vaccinated should stay in the hospital or the clinic for at least 15 minutes in case you might be allergic to something in the vaccine. Not only that, we need to be smart about it. Before getting vaccinated, be sure to document any known allergic reactions on your pre-vaccine checklist. If you have had a serious allergic reaction to something other than the vaccine, you should stay within the immediate area around the vicinity for 30 minutes after your vaccine. And if you are allergic to something in the vaccine, you should not get vaccinated. And more than that, you should discuss any concerns you have with the vaccination team. Next one. Another question, what about pregnancy and breastfeeding? Pregnant women who get COVID-19 are at greater risk of being hospitalized, have an increased risk of death, and even greater risk if they have another chronic condition. The vaccine is recommended by American College of Obstetrics and Gynecology for those planning to become pregnant to protect against COVID-19 prior or during pregnancy. If you're breastfeeding, you should go ahead and also get the vaccine. There is no way for the vaccine to get into the breast milk or affect the baby. You should not stop breastfeeding to get the vaccine. There was a recent study that came out in June of this year, 2021, in New England Journal of Medicine, where 3,900 participants enrolled in the Be Safe Pregnancy Registry. 827 had a completed pregnancy. 712 resulted in a live birth. 115 resulted in pregnancy loss consistent with the normal rates of miscarriage around. So this was no different than if the COVID was not around. These were normal. Nothing changed just because COVID was there. The resources to make a vaccination appointment, we have the New York State Vaccination Hotline, which I'm sure your organization will share it with them and they can give it to you. And the NYC COVID-19 Vaccination Hotline, which will also share with your organization. It will take time for everyone to be vaccinated. Next. In the meantime, we must all keep doing what we know works, and that is WQ. Wear, wash, watch. Wear a mask, wash your hands, watch your distance. Thank you. Importance of communication, transparency, and trust. Vaccine confidence starts with you. Choose to get vaccinated yourself. Start these conversations early on and engage in effective conversations. Be prepared for questions. Next. Thank you.
Thank you, Dr. Gupta. At this particular time, we're gonna go to the question part of the forum where we take questions from our attendees. And so the first question is, and you partly answer is, if the virus can still be spread by those who received the vaccination, and as of today in New York State, 58.7% of people have received both doses and everything. The problem is, you know, it's gaps in the system because that's only those 12 and up and everything. So we still have populations that haven't received it within that 12 and up, but also from obviously younger than 12 years old. So why is it important that people still get vaccinated if people who receive it are breakthrough cases and so forth? Why is it still important to get the vaccine?
Great question. Very, very. So here, let me go with the basics, right? Just imagine if you did not get the vaccination, what would happen then, right? Right now, after vaccination, the amount of spread that is happening is much lower, as you can just see with the hospitalization numbers. Last year, I was at 2,500 patients in the hospital. Today, they are positive, but the hospitalizations are only 125, right? So there is still there, we are still spreading it, but the symptoms, the duration, the hospitalization, the complications all have trickled down. It's much less spread. And as you rightly said, Professor Boyce, the more we get vaccinated, the less chance we give to these mutants and the strains, which are deadly to control. Today, it's Delta. Initially, it was Alpha. I don't know what we have for the future, right? So we need to be just smart to go for it, do it, and protect not only ourselves, but our entire community.
And that's a good point. And I just want to add, you know, and particularly, you know, many of the hospitals, the ones that I'm associated with, I give example, Harlem Hospital, you know, every patient in there with COVID is an unvaccinated patient that we see. And they fall in two categories. One of the categories are pregnant women, which you just addressed. And 100% of them have been asymptomatic. And so they actually come in to have a baby, to deliver, give birth, and they find out they're COVID positive and everything. And so prior to that, they had no clue that they were positive. So, you know, and it's a good thing that every patient that comes into a hospital now is tested. Otherwise, you know, the spread among those who don't have symptoms will continue. And then we also see an overwhelmingly large number of those above 80 that's in the hospital. And for the majority of them, again, they're unvaccinated, but 9 out of 10 times they're getting the vaccine from either a loved one or a caregiver that comes into their home. So can you speak to that, how important it is to protect those populations?
Absolutely. Let me just start again by a very simple analogy. Tell me something. I'm opening it up to the entire group here. How does the virus know whether I'm a Democrat, liberal, black, white, right, Republican, or a conservative? All what the virus knows and does know is whether you are vaccinated or not. And the virus really thrives very well in unvaccinated individuals and causes much more death and severe disability in people who are not vaccinated, right? We may be carrying it unknown, not even knowing the fact that we are carrying this virus. And imagine going and meeting your elderly grandparents, for that matter, right? Who are having diabetes, kidney condition, or some other comorbid conditions. We don't mean to, but what we are doing is we are transmitting it unknowingly, unintentionally to our loved ones who now contract the COVID and suffer the consequences of hospitalizations, complications resulting in death also. So what I'm trying to say simply is you're not only protecting you, but you are protecting your loved ones all around and the community that you live in and you breathe in and you breathe with.
Thank you. Now, today we're hearing about Delta, the Delta variant, but previously it was the Alpha variant, and there's been some in between. And so one of the questions are there other variants? And the answer is yes. And I would like you to elaborate on that, please.
Okay, the research is still ongoing, right? We keep coming up with new strains, new variants. Initially, it was a UK strain, the Brazilian strain, then the Alpha, and now the most deadly one is the Delta variant that we are all seeing across. Trust me, if we don't keep our vaccination rates up, we will be seeing very soon, and they might be already out there. We just haven't come up with the names and the types of it. They are still coming on because, as I said, research hasn't stopped. It keeps going and going. Let me start by a simple example of telling you, for the past decades, we have been getting a flu shot every year, right? This year, NYP campus-wide, 10 hospitals are for NYP, only one flu case. How come? What happened? We had so many flu-related deaths nationwide. What happened? Why? People started washing hands, wearing masks, right? We started learning how to wash hands. What happened to flu suddenly? We were getting mutants every year, a new strain. New vaccine would keep coming up every year, and people would start getting the new vaccine every time. But still, we were not able to beat it. Eventually, what made us do it? It was helping protect us. But what we did this time, as Professor Boyce is just making some hand gestures, washing hands and wearing a mask. So what I'm trying to say is this will not stop. It will not stop on its own unless we take the ownership and the responsibility of it. We have the tools, and the best tool for us right now is the vaccine. So we need to take that step to go to the next step.
And this is a great segue because they moved to the Greek alphabet for the variants now, but in reality, they started out with based on a country of origin. UK, you have the Brazil, you have all the ones, and the Delta was associated with India. And so there are other variants. There are at least up to Lambda, I heard. But my point is, given the spread of all these variants, a question I've received is, should we cancel any travel plans because of these variants? Because it seems like it's coming from certain locations and stuff. So what is your recommendation regarding travel?
Tough one, very tough one. Listen, I myself have not traveled in this past year and a half. I'll be honest, I am traveling day after tomorrow. My kids haven't seen the outside world. I'm taking them with a lot of precaution, but you need to use your judgment. You need to be cautious about it. I would not say go in a crowded area and start getting people on top of people, but be mindful, be careful, watch your surroundings, right? Protect yourself and your loved ones. At least vaccination, wearing your mask, hand washing frequently, maintaining the distance as much as you can. These are all the helpful tools to not only prevent yourself from getting infected, but preventing others around you to get infected. So it's a personal choice, Professor Boyce. I'm not sure I can really answer one way or the other,
right.
But what I can definitely say is use your judgment, use some common sense, and I'm sure you are all smart people over here. You can think about it, think what is best for you, right?
Right, and also, we receive federal guidance from the CDC, but they always defer to the local case rates and what's happening locally and everything. So it may be different depending on where you live at. Like here in New York is very different than what's happening in Florida and Alabama and the southern states right now, which is, having what we had last spring, in terms of their numbers and everything like that too. But one of the things as we approach, this summer and everything, I see there's a lot of eating going on, restaurants that open up, and a lot of people are once again going back to eating indoors. What's your recommendation about that? Because we talked about what we do to stay safe, And are those same things applicable to when you go to restaurants, like wearing masks and staying outside of crowded areas?
So personally, I prefer being outside, and I prefer being sitting in open spaces with my family and being, as I said, using masks and hand washing and distancing and all that. I follow those very religiously. And I recommend, again, each and every one of you, Googling stuff is very easy, right? And you'll get all different types of answers. But please, if you look at the guideline that will really help you come up with these CDC guidelines, for example, right? It's so open and clear there what you should do to prevent it, to prevent yourself getting infected and your loved ones. Follow them religiously. Go out in open spaces, meet your friends. I'm not saying just keep staying away from them. You should. Socializing is really important, but with caution. Make sure your friends and loved ones around you are vaccinated if they need to be. And if they're not, you need to do that education. You could be their team leader and tell them, hey, I believe in this. These are the consequences of not getting. In fact, you should be that leader. Why is so much mandate coming in so many health industries? Forget the health industries. Google, Morgan Stanley, Chase, right? Colleges. Why are they taking this step up and mandating it? Why? Because they want a safety net for each and every one of us to have a safe environment for our learners, for our communities. So I want us to use it and respect the mandate, because it is not directed towards any one individual. It is directed to each and every one of us. And as people of the United States, as citizens of the United States, it's our responsibility to step up.
And you bring up good points. You know, a lot of businesses as well as universities are going to mandate for the vaccine, but even Metropolitan College in New York, as we move towards the fall, they're going to make mobile vaccine units available on the campus to provide vaccines for the MCNY community and stuff like that too. And so that's important in light of, you know, many people that may not have access to the vaccines in terms of transportation and things. And so Metropolitan College is bringing it to the people, you know, going to and everything like that too. Why is that a good strategy for universities and health organizations to do in terms of distribution of the vaccine in communities, particularly communities of color?
I think this is a great initiative that hats off to Metropolitan College and all the other organizations. They are taking it to your doorstep, bringing the vaccine to you so you have easy access. If you still have doubts, trust me, please talk. I'm sure there are tons and tons of resources at Metropolitan College itself. If you're not comfortable, have small group discussions. Hear what people have to say who took the vaccine. I'm myself a woman of color, right? Educating my own staff. My admin is also a person of color, minority, but she's now able to educate her own family because she was getting a pushback from her family not to get the vaccine. She took the turn in the opposite direction, got herself vaccinated, and is educating her family, saying, look, I work in the healthcare industry. I know this is important for you and me and my entire community and family. So I am getting vaccinated, and I'll make sure each and every one of you will come forward and get vaccinated. So she had to change her mindset first in order to help change the mindset of her family. So, and this was pretty much a long-winded discussions and conversations numerous times with her, which is okay. There may be inhibition. There may be some resistance to it. That's okay, but you need to talk about it. The more you talk, the more information you gather, that's better. But once again, not from every website on Google. You need to stick to one that is nationally recognized, known, CDC, WHO. These are the websites I would encourage you to go on them and read. And they mark their word by word.
And that's a good point, because there's a lot of misinformation on social media. So yes, we need to make sure that there's a credible, websites and organizations that those in our community who may have distrust of the government for various reasons, or have vaccine hesitancy, where they can go and get credible, solid information. And so you mentioned a couple of them, and that's important. Would you agree?
Absolutely, absolutely, Professor Boyce. I 100% agree, and I encourage each and every student and faculty and whoever is listening to not only spread this word and wealth of knowledge, but tell them just don't go through 10 different websites. Stick to one. Stick to just the CDC, and you'll be good with it.
And also, we know that not everyone will be able to get the vaccine for medical or religious reasons. So what's the best way to protect those in the community who may have an exemption? What's other than the vaccine? What's another opportunity we can protect the community where we have those who may not be able to get it?
Sure. So I think that's, again, a very good question, Professor Boyce. I feel, again, as we said, if you can get the vaccine, go for it. If you cannot, as Professor Boyce mentioned, religious and medical reasons, again, mask, hand washing, and distancing. That's, as I just said, wear, wash, watch, right? Those 3 W's that we just spoke in the last slide. Wear a mask, wash your hands, and watch your distance.
And again, as we saw, New York City has started out with the healthcare workers in terms of putting in place a vaccine policy for mandate. If you can't get a vaccine for whatever reason, you have to get tested every week. Then some businesses has followed across the city. Other employees will have to come online in terms of the policy too, and then over the next month and a half and everything like that too. So we're seeing that we may have stalled in terms of vaccine compliance, but again, city, states, and at the federal level, the government have opportunities to enforce or to increase compliance, or at least increase testing. Well, what do you think of that as a strategy?
Okay, so that's a little tricky, but I will answer it to the best that I feel. We all had a choice, right? In the beginning, we tried education, putting out resources left and right to help educate. It didn't fly well. And what happened was the wave never stopped. We had the first disaster pandemic wave last year. Second wave happened, and we started getting new variants every time, deadlier than the first one. Still, people started refusing vaccine, right? Now, what is happening? You are not only putting yourself in jeopardy, but you are putting people around you in that same state, probably even a deadly state, because you do not know their medical conditions. So I think mandating is positive for each and every one of us, because now it's opening up more doors. People are willing to listen, to gain the knowledge and the reservations they have. The common question is, oh, they gave the approval in an emergency. Yes, because this was an emergency. Everything stopped. Everything else stopped, but the focus was only on COVID-19 vaccine. So it was getting processed at one time, tested simultaneously, and figuring out how and when to get it approved, because it was so urgent, emergent to save lives, to help protect our nation and our community.
Good question, good answer. And as a follow-up too, given we have the Pfizer and Moderna vaccine, as well as the Johnson & Johnson, why is the federal government still having a vaccine program operate under emergency use approval or not full FDA approval?
It's already going through an FDA approval. It's just taking its course. But that doesn't mean, like, I know these vaccines started late last year. Probably I was the first on the line to get it. I'm already 8 months out of it. I see patients on a daily, regular basis, use all my PPE and everything. I have 2 little kids at home. I have a full family, right? I have a whole family. Again, being cautious despite the vaccine, we are good. We are good. We are well protected. FDA is already underway, reviewing it and working it, being more cautious about it. But that should not stop people from taking the vaccine.
Because I actually come across a lot of people, who say, not a lot, but some who say, well, I'm waiting for full approval and then I'll take the vaccine. So again, some people may weigh, it's like, well, it's emergency use approval. I don't know what that means to them, but I guess for them, full means a different thing. Is that the same?
Nothing will change. I don't think so. 165,000 people, right? If we just were going over the numbers, how many people got vaccinated? And what have we seen? That with all that, we are still getting the Delta variant. People who are vaccinated are still carrying it, but they are not getting hospitalized. Only 125 people out of the 2,500 that I had during the first pandemic wave. So they may still get infected, but they're not as sick as to the extent that they require hospitalizations. So that's the difference. I don't want my community, the people I work around, the people I live in the New York City, waiting for that FDA approval to get infected, get hospitalized, get intubated, and bear the complications. And then you have the FDA approval. Now what? You already lost your golden opportunity, right, of protecting yourself.
Okay. Now we're moving to talk. I believe one of the pharmaceutical companies, they are in works, at least in France, to do a booster shot of the vaccine. So where do we stand here in the United States in terms of booster, and particularly the time frame in terms of how long would a booster last in terms of a third shot for those who've taken either the J&J 1 dose or the 2-dose Moderna or Pfizer vaccines?
So Professor Boyce, that's still in the research. This was a question just raised at NYP, I think this past week itself. There is a talk of third dose, especially for immunocompromised patients. Is already underway, but for the booster, it's still in the works. I don't think I have a clear answer for that yet. It's ongoing. I'm not saying they're not talking about it. They are thinking about it. As I said, we get an annual flu shot every year, right? Is it going to be one of those? Maybe we have to take it every year. I don't know the answer. So I really cannot answer that appropriately or correctly, if I may.
And so that dovetails into another question. You know, I've come across some people from the community say, well, you know, I'm wearing a mask, and I never got the flu shot, but I'm wearing a mask now. And so why should I get the COVID shot? Because I'm wearing a mask. Why do I need to get the COVID vaccine? I'm wearing a mask and I'm washing my hands. How do you respond to that?
Again, you never know when you'll be, maybe you will not have symptoms, but you may be carrying it. You may give it to someone else, right? You may be giving it to some loved one of yours. And then what? Then what? Not only for you, but for your own family, your own community, your loved ones, your colleagues, your faculty. You have to do it. Let's not be selfish here, right? Let's think of the nation as a whole, and we are part of it. We are one of the bricks that the nation is built upon. And I am that brick. I am one of that brick. I lay the foundation of my country. So I have to respect that. I have to work as a team. And it cannot be I. It has to be we. It has to be us. So we have to go hand in hand and work together.
Thank you. What are some other strategies your organization is doing in the community to build vaccine confidence? What are some other ways we as a community can spread the word about the importance of vaccines?
I think what is very important, Professor Boyce, is to hold these sort of webinars are great, but I still feel there are groups of people who are not comfortable speaking up. So I feel having small group discussions with 5 or 10 people face-to-face or on a small Zoom group meeting would be very helpful to really figure out what is holding them back, help them educated, even one-on-one sessions. This is what, and providing a lot of resources available online, in person, to really help them overcome those difficulties. So we need more resources, more education, and actually one-on-one discussions with the group.
Can we also partner with community-based organizations and local businesses to spread the word, like local influencers, and to help get the word out?
Yes, Truman can tell you more, but we have already given so many talks. I think I myself have given 3 or 4 talks already to the Lower Manhattan community, Westchester School District, and there was an elderly population group that we also spoke about. And after that talk, I got 3 emails saying, after hearing you speak, I took my first dose. So, you know, a group of 50, and if 3 people took the vaccine, my job is done. It was I felt very thankful. So if today I can have one of you take the vaccine, I am done. I'll be the happiest person that I did something for my community.
And before we wrap up, one last question regarding the reopening of schools, particularly public schools for elementary, middle, and high school, in terms of, there are different things going on across the country, but here in New York, I believe they have to wear the mask, inside the school, particularly if you're not vaccinated. Is that a good thing?
Very tough question. Both my kids are going. They are in elementary school, not vaccinated, but you know what? They need that social interaction also. I cannot keep them home. They need to go out. They have to interact. That is how you learn. You cannot be the rest of your life on a Zoom and learn about everything. You need to face each other. You need to get that feel, that human touch, that body language is so crucial. So you have to socialize. We are social animals. That's what human beings are. I cannot put you in a cocoon or, a dungeon and say, okay, here you go for the next year because COVID is there. No. Yes, am I worried? Yes, I am. But is this the right thing to just keep them home? Absolutely not. They will go. They will wear their mask to the best what they can do, a kindergartner can do. And they will do what others do and will learn. And we'll wear it together. Hopefully the vaccine for 2 and above will come out soon.
Right. And I can say I have 2 sons who received the vaccine, who was home for 15 months. And, remote learning was not a good experience. You need that social development and interaction. And as a parent, you're always worried, when they go to whatever, out into the world with other people. And, my youngest son who's 14, he actually went away to a sleepaway camp, just returned after 2 weeks. And so before he went to camp, we had him COVID tested 72 hours before. And upon his return, we had him COVID tested just to make sure. The camp did not have any positive cases during that time. And so this is what you have to do on an ongoing basis, not just, okay, I have the vaccine and that's it. You still have to, because we know there are breakthrough cases where people are vaccinated. And I do have 2 relatives who received the vaccine, are breakthrough cases, but they live in a state where we don't have the protections we have here in terms of public health. They live in Texas, so it's different environment where nobody wear masks and so forth for the most part. So again, all this stuff is done to protect the public. And as a public health person myself, I'm always thinking about what's for the collective good of society. Would you agree these safety precautions for the protective good of all of us, even those who may feel that we infringe upon their civil liberties, but we have to protect the public?
Absolutely, 110%. I agree with you, Professor Boyce.
And so as we come to a close, I just want to give you a last opportunity to say some parting words of encouragement to our community. And again, we thank you.
Thank you again. It has been my pleasure and an honor. Thank you, David, for walking me through the process, very seamless, and the leadership as such for Metropolitan. I am here for each and every one of you. If in any shape or form I can help, I'm more than happy to. But I can only help you if you help us and work together. Guys, let's, what they say, man up. Let's get the vaccine. Let's help each other and work towards a better future, because there is a great future ahead of us, right? This is one of its ups and downs that we are going through. We just need to stand together. We can do it. You all have it. That's all I can say. So let's do it together. And NYP Presbyterian is with you. Let us know how we can help, and we're always ready to jump in. Thank you.
And again, if we don't, we may face a future where this is the new norm. And I'm sure no one wants that to be the case, where we continually wearing masks and having these conversations about vaccines, 4 or 5 years in the future. So again, I thank you for spending time with us here at Metropolitan College of New York to build vaccine confidence and to educate our community about vaccines and vaccine equity and everything else that goes along with keeping us all safe. And at this time, I'll defer to Associate Dean Hahn.
Thank you, Professor Boyce. Again, on behalf of President Pissarro and Vice President Crookendale, I'd like to thank Dr. Greta Strong for introducing us to her colleagues at Weill Cornell, New York-Presbyterian, Lower Manhattan Hospital. I'd like to thank Ms. Chumem Lai and Director Tina Giorgio for assisting me with the arrangements for this evening's webinar. I particularly want to thank you, Professor Boyce, for continuing your service to the college in our efforts regarding COVID-19 and vaccination and education, and for taking so much of your time to assist us with these webinars and other efforts. And finally, I'd like to thank Dr. Gupta for taking her valuable time to assist us in this educational effort and sharing such valuable information with our community. Thank you very much, and good night.
Thank you. Bye.
Be safe, everyone.